According to UNICEF, Nigeria has the second highest burden of stunted children in the world, with a national prevalence rate of 32% of children under 5. The T.Y. Danjuma Foundation is partnering with the Miradex Hope Initiative based in Jalingo, Taraba State to combat malnutrition and improve infant and young child feeding practices through their community-based management program.
My name is Dason Bello Maman, project coordinator with Miradex Hope Initiative. Basically, Miradex is into combating malnutrition, and focus is the community-based combating of malnutrition.
Yaron da baya zama, in an ajiye shi sai ya kwanta, da aka ba mu maganin ya fara zama, yanzu har yana tashi yana sayuwa ma. Mun ga maganin ya yi amfani sosai.
Our intervention has been one of the key interventions in Taraba State that combat malnutrition.
In these remote villages, over 1 million children are at risk of acute malnutrition, with severe cases potentially leading to fatal outcomes.
Currently in Sunkani, we have about 86 cases, with additional 7 cases during our routine programs weekly, which comes every Tuesday.
Tun daga cikin watan azumi Bashir ya fara yin zazzabi. Zazzabin nan sai ya shiga ba, sai amai ya zama baya shin abin shi, duk abin da aka bashi dai sai amai. Mun je asibiti an sa ruwa leda 3, ke dai mun zaga mu je wurin wanzame mu koma nan babu.
The project ensures that children with severe cases of malnutrition receive the necessary medical attention, while also focusing on training and empowering caregivers with essential skills.
Roof, we give ready-to-use therapeutic food, which is this a sample of it, and that's what we use to manage those that are in severe acute cases. We try to manage those that are in acute with roofed. Then the moment they are able to recuperate, we continue with Tom Brown to support their well-being. If there's any clinical case, we refer them to the stabilization centers.
Muka je Giware, suka dube mu, suka ba mu abincin yara. Alhamdulillah, tun daga wancan lokacin amai din ne ya yi stopping, komai da ya yi stopping. Mun ga yaro na yanzu yadda ya kasance.
The project aims to improve the capacity of 90 primary healthcare workers, enabling them to provide better care and support to malnourished children.
Training was conducted for about 18 health workers. The training is on community management of malnutrition, and then infant and young child feeding.
Most of us, we don't know that some of these malnourished children are existing. Until the coming of this program, we are able to realize that we have much more of them in the local government entirely.
Program da ake yi na tallafa wa yaran da suka rame bisa rashin cin abinci. So gaskiya lokacin da ake koyar da yadda za a warkar da yaran, ni ma na kasance ɗaya daga cikin wadda aka koya wa yadda za a yi a warkar da su. So a yayin da aka je koyar da mu, na koyi abubuwa da dama.
This work was given to us so that we can be able to identify the malnourished children. We use this to check the level of their nutritional intake.
Wannan nauyin da za a duba din shine weighing scale da za a amfani da shi. Nauyin ne zai bada adadin maganin da za a bashi. Already yana nan a rubuce a chart nasu, mu ma koya mana akai. Yanayin nauyinsa da kuma yanayin shekarunsa da kuma yanayin work nasi zai baka daman bashi kowane irin magani ne. So idan aka bashi magani satin nan ya kai ga ya gama magani, zai sake ya dawo wani sati a sake a gwada work nasi kamar yadda aka gwada na farko, a sake a gwada a weighing nasi kamar yadda aka yi weighing tun farko. In Allah ya yarda, idan dai har wannan yaron ya sha wannan maganin, to sai ya karu, jikinsa zai sake ginuwa, haka kuma nauyinsa ma zai karu.
Through step-down training sessions, caregivers receive guidance on optimal feeding practices and are empowered to make informed decisions about their children's nutrition.
And training was also done to the caregivers. We train about 100 caregivers with the knowledge of infant and young child feeding and the management of malnutrition.
I gave birth to my baby. The mistake I did is that I started giving my baby food in time when she was like a month, and I started introducing water to her, and my baby was running malnutrition. I left here in Jalingo. I went to Iwari and I met them there. They were sharing the plumping nut. So they gave me, and I come as I start giving her. I saw a lot of changes. In fact, my baby is recovering. I started giving her the plumping nut when she was 6 months. By then, we weighed her, she was around 3.5. But now that she started taking the peanut, she's 8 months old and she's now 6.5.
By fostering community involvement and participation, the project aims to create sustainable solutions to combat malnutrition in these areas.
It's always every Tuesday. You have to come, we now check you. But because of that, and we notice some of them are not really financially buoyant, some trek long distances to come to get this intervention. So we try to come up with a simpler way of helping them. So when you come like one in a month, we try to give you something that will cover for the rest of the weeks that you're supposed to come. Then probably you may come twice in a month. If you are further, maybe you come once in a month for us to check you again.
Ina ɗaya daga cikin wanda suka fara wannan program ɗin. Kuma tun da muka fara muna baiwa yara wannan magani, kuma har ga Allah jikinsu yana ginuwa yadda ya kamata. Idan muka gwada wannan sati, wani sati idan suka dawo muka sake gwadawa, suna karuwa sosai.
Through the power of media, the T.Y. Danjuma Foundation amplifies the project's interventions, spreading awareness and inspiring others to join the cause.
T.Y. Danjuma Foundation has been awesome. They've saved life. Like without T.Y. Danjuma, so many lives will have been lost.
We really want to appreciate T.Y. Danjuma for a very good job, because most of our children, in fact, they have been coming, they are the one announcing it to themselves. We are no longer using turn announcer, because when they look at my neighbor's child is recovering, they'll come and ask, how did you made it? He said there are some people that are coming to the health facility and they are giving them food. So T.Y. really from the T.Y. Foundation has played a greater role in Arokola entirely.
Through this collaboration with Miradex Hope Initiative, hope is firmly placed in the hands of these communities. Together, we can ensure a brighter, healthier future for all.
I want to really thank T.Y. Danjuma for saving so many lives. We have so many testimonies. I can't mention all, but there are so many testimonies.
Ina farin ciki da wannan T.Y. Danjuma Foundation ɗin. Gaskiya mutane suna farin ciki sosai.
Na gode T.Y. Danjuma Foundation.
Mun gode wa T.Y. Danjuma Foundation.
Thank you to T.Y. Danjuma Foundation.